You back now to Matlosana in the northwest, and that's where the Provincial Health Department is rolling out an outreach program for former mine workers at the Westvaal Hospital. The program aims to provide them with a service to claim for their unresolved benefits. And Newzroom Afrika's Refiloe Seboko is there. Refiloe, what's the latest?
Well, the latest, Imani, I can tell you that the Deputy Minister of Health, Dr Sibongiseni Dhlomo, has just had engagement with the ex-mine workers who are also sharing some of their frustration in relation to trying to claim. Some are saying that it's been over 10 years now trying to claim, but they have not been successful. But let's welcome Dr Sibongiseni Dhlomo. Thank you so much and welcome to Newzroom Afrika. Talk to us about this restorative program, outreach program, speaking to the ex-mine workers and some of the things that you picked up here today in the northwest.
Yeah, no, thanks you very much. And if I could pick up from some of your preamble comments, the frustration that has actually been amongst the ex-mine workers has permeated and reached the level of presidency when then President Ramaphosa decided to really instruct 3 departments. So it's a tripartite of departments: Department of Health, Department of Employment and Labor, Department of Energy and Mineral Resources, to work on this program, rightfully so, because there are former mine workers who must be examined medically and confirm that they actually did suffer this, that and the other, silicosis or TB. There are also, some of them will be compensated from the Employment and Labor Department because of other injuries, including pensions. Of course, we work within a space where people were working in mines, and therefore Department of Energy and Mineral Resources must also be able to monitor the progress. So my visit to Northwest today is to actually monitor the progress that they are making and actually thank them and accelerate their efforts. Because here in Westvaal Hospital, there's already a resident team that looks into and gets all those former mine workers to come in here and actually get their data taken and be compensated accordingly. So to date, since just last year when we really started very heavily on this intervention, over more than 20,000 of our former mine workers have been met, processed, and actually been here through this process. Over 232 million has been paid to all those. Now it's difficult to say how much per each, because first it depends how long you worked in the mines. And number 2, are you getting paid only from the pension, or from pension plus an injury, or from an injury alone, or from the compensation of the medical condition, be it silicosis or TB? So there are those who are only getting a pension payout, and there may be those who are getting all 3, the pension, the injury on the knee and ankle, and also getting TB. So it may vary. There are some who have already been able to get $1 million compensated for, and others have been getting from as little as maybe 100,000. So there is some money coming into our citizens.
And with your engagement, Deputy Minister, some dependents who are saying that we are unable to get the help because my husband has passed on or my father has passed on. He just asked the kids, and the death certificate says natural death. It doesn't particularly state that it was as a result of my father being an ex-mine worker and therefore having been sick as a result of that.
Yeah. So it's a myriad of complaints. The starting point is, in the first place, as I actually say, the President is really instructing us to really run with this program. Why were black mine workers leaving employment but never get the money to follow them? As early as, this is from 1965 to date, and people were just sent home, go back to where you come from, to the homelands, and therefore they are sick, they are old, they're in the rural areas. Now we have to run and look for the money in the banks to pay them. So there's that first lacuna, that if you're a black mine worker here in this country, your money did not follow you home when you retired or when you actually got retrenched or you just wanted to leave. But if you're a white mine worker, you were given the money right there. So there's the first part. As a result, you are correct. Some therefore have since died. And that is why we are working very closely within the Department of Health, because if Mr. Molefe died, natural cause, but we can look into the records, and it says natural cause but TB. We want to say, without fear of contradicting ourselves, any former mine worker who worked in the mines and died of TB, TB was contracted in the mines until proven otherwise. And therefore we are able to convince, and I'm happy that the Chiamiso Trust and all those who are compensating are able to listen and work within that space to say, this person, hospital records are saying that he died of TB, therefore let us pay, because in any event, this TB was contracted into the mine. So we really want to get the family members to come in. But mainly importantly is if there are any records, even if the family member is passed on, any records from a family member that can bring forward the wife, the children, we're looking forward to those things and bring them on, and then we could then process them for compensation.
Dr. Dhlomo, thank you so much for your time. Deputy Minister of Health, Dr. Sibongiseni Dhlomo, also indicating that millions of rands, Imani, have been paid to mine workers that they were ex-mine workers that they were able to trace, and that's why they've also came here in the Northwest Province to take this outreach program. They have had that engagement with the ex-mine workers, and we also had the MEC a bit earlier also indicating that they have made progress in the Northwest Province in trying to trace and track those ex-mine workers and their families or dependents so that they can be compensated accordingly.
Now, this has been going on for many, many years, and this is a silver lining in the story. Refiloe Seboko just giving us the latest on that outreach program. Well,